Hello, everyone. Thank you so much for helping out. My name is Ransom Nima. I'm a final year radiography student, a medical writer, and also a content creator, especially on YouTube. So today I have an amazing guest speaker, Dr. Sumayya, an amazing personality. She's based in the US, but I will give her the opportunity to introduce herself. So, Dr. Sumayya, could you introduce yourself to the audience?
Yeah, so thank you, Ransom, for having me. My name is Sumayya Al-Mansur. I'm a medical doctor. I have both clinical and public health experience. Currently, I am a doctoral student at the University of Maryland, College Park here in the US. I love health literacy, health education, and um, health equity, especially for underserved communities. And I'm glad to be here. Thank you.
Amazing. Amazing. I believe that the audience have a clue about what you are, what you do, and what you're currently studying at the University of Maryland. So the first question for you, Dr. Sumai, is how do you tailor health messages to resonate with a diverse cultural backgrounds and communities at large? Well, what do you have to tell about that?
Okay, so that's
Okay.
about
Okay. So
health practices, and even the way we interpret risks, health risks varies across cultures
okay.
and communities.
And
So
community.
one of the first
So
things I focus on is
things I
cultural
off is
relevance.
relevance.
It's not just about your
It's not
translating a
just about your translating a
message. It's about making
message.
sure
It's
that the
about
message
making sure that
itself
the message
makes
itself
sense
makes
to a
sense
cultural
to a
context.
cultural
Let's say,
context.
for
This
example,
is example
to promote
to
exclusive
promote exclusive in
in a community.
a community.
In communities like
Community
ours, Nigeria, you would see that the elderly they play a significant role in child rearing experience decisions for new mothers. So if you're going to target the population, your first go-to should be engaging those grandmothers, those elder aunts, so that you can influence them on infant feeding practices, and that will make the message effective. And if you're talking about health messaging, community engagement is so critical, so you have to make it a point to involve like community leaders, local influencers, and then also everyday people, so that they help you in shaping your health messages. And people love to be involved, so when you have to create a health message, you have to talk with the people, not just at the people. So they are most likely going to trust you more and act on the things that you're telling them to do. So if you're coming to, and I think that brings me to the facts, or what I like, that's transcreation. So you're not just doing like linguistic adaptation. And what do I mean? If you have a health message now in English, you just change it to different languages, like direct translation. It doesn't work. So it goes beyond that. You have to do, it goes beyond the translation. You have to ensure that that message carries the same meaning and emotional impact in different languages, because a phrase that motivates people in, let's say, Hausa would not be this, it won't give the same impact in Yoruba if you translate it like verbatim. So people in one culture might not look at it the same way as the others. So you have to find the right tone, the right words, and even the right visuals so that it can resonate with your target audience.
Amazing, Dr. Sumaya. Thank you so much for sharing your thoughts on how you tailor health messages to resonate with a diverse cultural backgrounds and communities. I love the fact you mentioned about different tribes, because the kind of tune you used for Yorubas in Nigeria won't suit for people that are Hausas in Nigeria. The same applies to Igbos as well. And it's amazing that you're creating that messages to pass a common information, not just to a specific background, but a very diverse cultural backgrounds and communities at large. Thank you so much, Dr. Sumaya, for sharing your thoughts on that question. So that draws me to the next question for you. What common mistakes do organizations make when communicating health information, and how can they avoid them? Talk us there.
So I think this is a very interesting question because we see these mistakes like a lot. We see them a lot. And I believe if you see that every organization, even I use the word every, but most organizations, they often have the best intentions. But then we tend to see these key missteps that can cause health messages to either fall flat or at worst backfire. So one a big mistake I think is overcomplicating the information. So most times, like as health professionals, we spend years learning technical terms, but most people that you're trying to send that message to as an organization or the government, they don't have that background. So if a health message is filled with jargons, people will just tune out. People will not relate, and you need your health messaging as an organization to be relatable. So let me give you an example. I have seen that, and I'm sure maybe if you reflect back, you'd have seen it maybe on TV adverts. You hear people, okay, let's say for example, you'll hear something like individuals should consume adequate amounts of omega-3 fatty acids to reduce cardiovascular disease. Does it relate? I'm sure you would have heard it somewhere. It's a lot. You'll hear a lot of omega-3 fatty acid. So I think that's just a whole lot for someone that is just a market woman to unravel. So it's as simple as just saying eating fish like salmon can help you keep your heart healthy. So if you compare these two things, they basically mean they're passing the same message, but one is just simple, clear, and actionable compared to when you're using omega-3 fatty acid and all that. And another thing organizations also do is they ignore cultural like nuances. I've seen like campaigns assuming that what works in one community will work everywhere else. So you're just running one campaign across the whole 36 states, or you or even across like countries. But health behaviors, when we look at it, they are deeply rooted in a lot of things, in culture, in religion, in personal values, which are different. So if we don't take these things into account, messages can feel very irrelevant or even offensive at some point. So you're bringing out an information with a good intention, but then it's offensive to the people that you're relating the information to. So, and another issue is like focusing too much
Focusing
on facts
on fact.
and not enough on emotions. So information alone doesn't drive behavior change. Stories do. So when people remember stories because they can connect with them emotionally. So for example, you're talking about maybe diabetes. You just say 30% of people with diabetes don't manage the condition, and it leads to this. It's very forgettable, because I won't ever, at the end of your campaign, I can't even remember the statistics you mentioned. But if you're going to do a campaign and you make it about a story, okay, so let's say, for example, okay, so a father regained his energy and got back to playing soccer with his kids after managing his diabetes, which he could not. So it's relatable. People, there are fathers everywhere. And another thing, so stories sell, and a lot of people are doing amazingly well when you are using storytelling for health messaging and campaign, Dr. Aproko and the likes. So, and it sells, and the impact is made. So another thing is, I think another, will I say, solution can be test your messages with real people before launching them out. So just don't be in your offices and create messages and just launch without like test running them. Gather feedback, refine your approach from the feedback that you have gotten, and make sure that the message actually resonates to the target audience. And you have to prioritize like things like clarity and cultural relevance. I think I will keep repeating cultural relevance because it goes a long way in health messaging and emotional connection too. So I think with all this, you'll be able to avoid like major common pitfalls that
One
we see
pitfalls that we see
in health messaging.
in health messaging. Amazing, Dr. Sumayya. Really amazing. Because these are really common mistakes organizations, make when, communicating health information, and how, they can also avoid them. Thank you so much for talking us through about that. I loved, the narrative you shared, as a med student studying radiography. Um, I do agree that it mustn't be jargons. You don't use a medical jargons to someone that don't even have a clue, or don't even have healthcare background. We can just use simple terminologies. Like, for instance, not everybody knows what hypertension is all about. Because hypertension is low blood pressure. Not everybody that's not in the healthcare field that knows what hypertension is all about. You could just simply say low blood pressure. So in essence, is if you're an organization, a healthcare organization, whatever organization you are in the healthcare field, if you're communicating health information to a wider audience, people of different backgrounds, you have to deduce your usage of medical jargon as well. And also using of stories, like Dr. Sumaya said, you know, she's in the field, she deals with community people, she's a public health, specialist, sorry, they do amazing kind of work in the community. I know one of the courses you guys did in school was epidemiology, community health, and all that. Yeah, I did the course in my fourth year, and I know how critical it is. Because you have to move if you're studying that kind of course. Have to move from one community to the other. In terms of improving the healthcare, span, which is amazing kind of thing. So for her to say, for you to use a story or stories to, communicate your health information to a wider audience is really, really very important. So make sure you guys take note of it. Thank you so much for talking to Stereo, like I said before. So the next question for you is, can you share a case study where culturally smart messaging significantly improved health outcomes? Talk us there.
Okay, so I think there are a lot of campaigns that have done well. The same way there are a lot that have flopped. So I think the top of my head, there's one campaign that stood out for me, which is, I think it's very recent. I don't know I can't remember how recent, but then I came across the campaign. I think it was sponsored by MSI, Mary Stopes. It's an NGO. It's on family planning, and it was named, I think, Gagarabado. They carried it out in northern Nigeria, I think Kebbi, Zamfara. And what stood out for me is um, the way they carried out the campaign. So we know that um, in the north, like the society, men take the lead, right? So they're the decision makers and all. So they were trying to educate and advocate for family planning, and they were using places like Meshai, that's where they sell tea. So all those, like, let's say, like a coffee shop, we can say a coffee shop, but in the local way. So they used men. So they were going to those places and educating the men on family planning, and their buy-in to family planning, and then leaving the men to take charge. So if you look at it, if a man that is in charge of, like, his home is championing family planning, definitely it will sell and it will work and you will get like the outcome. So they took all those things in the cultural context into play in there, and it did amazingly well. So I really liked that project. I've seen papers on it, and I've seen how successful it was. So if people can take like lessons from that, look at the environment and look at what's the dynamics in that environment, and then use that to create your cultural your messaging, it works because um, it reinforces the idea that we are meeting people where they are at. You're culturally meeting them where they are. You're emotionally meeting them where they are. You're linguistically meeting them where they are. And this will actually make real change happen instead of you just creating programs for them, not with them.
Dr. Sumaya, I'm
Yeah.
a bit curious. You know, we med students are very curious sometimes. You mentioned about carrying out a health outcome outreach in a particular community, and you were specific about the gender of male, which is amazing because male are always at the front or something. Do you think that gender bias is also inclusive in terms of health, improving health outcomes during outreaches? Do you think gender bias is inclusive?
Yeah, definitely.
Yeah, definitely.
There are biases
There are
everywhere,
biases everywhere.
whether subconscious bias or real biases. So when you're actually going to do a health outreach, for you to get good positive health outcomes, you have to take in place like the gender dynamics of the community. And uh, if you're in a, to use the word loosely, a patriarchal like setting, you would have definitely, for you to have a positive outcome, you should involve the men. That would be your best. So but if you go to a setting where it's there's a bit of balance, women are as let's see, the rights are basically the same or similar. So you would just advocate everybody on the same playing field. But then biases are real, and we definitely cannot deny the fact that they impact health outcomes.
All right. All right. Thank you so much, Dr. Sumaya, for talking us here about case studies where, culturally smart messaging significantly improved health outcomes. And thank you also for sharing us on you know, gender biases in terms of significantly improving healthcare outcomes, especially during outreaches, in terms of healthcare messaging. Thank you so much for talking us through, Dr. Smile. So that draws us to the next question. All right, so this is a very, very extensive question for you, but you seem you're ready. So let's go. How do you balance scientific accuracy with accessibility when crafting health messages for the public? How do you do that?
So that's
So
that's really
that's
important. And it's such an important balance to strike because I always say that we're not simplifying the science, we're simplifying how we explain it. Because if you simplify the science, you'll lose the whole credibility. So I think for me, the first thing I use is plain language. Like medical terms can be intimidating, even for me. So I focus on making things very digestible. So instead of saying vaccine triggers adaptive, blah, 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 you're talking about anti-gene specific antibodies. No. So we just go straight to vaccine teaches your body how to fight the virus so you don't get sick. As simple as that. It's the same science, it's just that it's clearer. Nobody wants to, and nobody signs up for a lot of jargons. So I think another approach is making health information visual. Like people, we're in a digital space, it's a digital world. Everybody likes videos, everybody likes social media. So make health information, make visuals, make infographics, animations, and I would always go back to culturally relevant illustrations. that can break down complex ideas in ways that it's easy to understand at a glance. Because when there's this hustle culture, we're always on the move. So you don't want to give a 5 minutes, a 10 minutes video. Nobody has that time to sit down. So your first 1 minute, send your information. And also I always keep in mind that if people don't understand the message, they won't act on it. So the most important goal for me is to make health messages, they should be both accurate and also accessible. So I think those are the things that I put at the forefront when I think of like how health messages.
Amazing, amazing. I love the fact that you have the public's interest and heard, because there are people that don't really care whether they understand what they're saying or not. They're just there to pass information, which is very wrong. And yeah, there are people in healthcare too that don't even know some medical jargons as well that you can use, that it sounds really surprising, because already you're in the public health field. There are some medical jargons you would hear in terms of vascular medicine, surgical procedures, that you say, are you sure this is a word, or are you kind of like framing it? So as we going further, if you're a healthcare professional, creating videos, not just creating videos, creating authentic videos that is passing, that is clear and passing the right information to a diverse audience, because not everybody in the healthcare field don't come across a video. There are people in different backgrounds that will also come across a video, and if it's not clear enough, I think you're not doing the right thing. Thank you so much, Dr. Sumayya. So the last question for you. All right, so there gonna be like too many healthcare professionals that are gonna watch this video, and I want you to tell us your strategies, or what strategies can healthcare professionals out there that are gonna watch this video, use to ensure their messages inspire action, immediate action, rather than just awareness.
Okay, so
Okay, so
this
it's a
cool question
good
because I
question because
big difference between awareness and action. So just because someone knows something is important doesn't mean they'll do it. I think we all know that it's good to eat healthy, it's good for us to take walks, it's good for us to stop smoking, but we still do it regardless. So I think to bridge that gap and to ensure that our messages inspire action, we can first of all is create behavioral nudges. And what do I mean by that? We should create small, well placed like reminders. They make all the difference. We're human beings, we forget. Even if we know something, we will forget. And reminders work, reminders are good. So for let's say I'm a mom, so let's say for example the vaccination schedule, it's very easy for us, and I'm talking from experience, being a healthcare worker, but then put in the heart of a mother, you see that we tend to, the immunization schedule will take our children for immunization the first few months, but when it reaches 9 months, the vitamin A, we forget. Some people do forget. So these are things that maybe they can be sent like reminders, and it would go a long way so that people tend to follow through like those appointments, and it can relate to other things. I think we have done that excellently.
segments, it can relate to others.
And
Excellent.
people the adherence because of the reminders, or people tend to go back to take their ARTs. So that's another thing is social.
Another thing is social.
We are social beings. We like to copy. Or we like to see what other people are doing, and so most times, if we're like giving messages, just don't mention things like maybe breastfeeding is good for you. It's not going to be effective. Try to use like the psychology of social norms. You can make it like your neighbor. This breastfed her child, and the child is doing well. So people tend to like look at what's around them, what's acceptable around them, and they do it. So show proof, like testimonials, let them see that people like them are doing it. So definitely it's kind of reassuring, and it makes you like take charge of your own health. So that's another thing. Then third thing, I think third or fourth, I'm not
Then
sure,
other thing,
is
I think third or
personal
fourth, I'm not
education.
sure, is personal.
So and the more tailored the message is, the more effective it will be. So instead of just you were using women should get screened for cervical cancer if you're in the north. I think a Aproko doctor also does that. Like call a name, Aisha, you're due for cervical cancer screening because your age. If there's an Aisha there, or it means you're talking to me, and I would take more action than just I'm just hearing 10% of women. I won't put myself in that 10% or the statistics. So you personalize it. So I think at the end of the day, like when we're talking about effective health communication, we're not just talking about delivering facts. The facts will always be there. So we have to actually remove the barriers, and for us to make healthy choice the easy choice for people to be able
To
to
be able
uh, take action
to take
based.
this. Amazing. Thank you so much, Dr. Sumayya. It's a great honor to have such a caliber of you on our podcast, and I believe that the audience will really enlighten them more. So if you have questions, you can drop in the comment section, or you can reach out to Dr. Sumayya. You can connect with her on her social media handles, which will be added on the YouTube description below. So make sure to watch this video to the end as well. Thank you so much, Dr. Sumayya,
Thank you
for your
so much.
time. Thank you so much. Yeah, we do appreciate it.
Yeah, welcome.